Hi everyone. Hopefully you are having an awesome time with the Wellness Expo so far. My name is Hope and I am doing a talk for you guys today about scars and swelling and all the things in between. So I am going to share my screen with you guys and we're gonna do a bit of a talk. All right. So just a little bit about myself. So I'm originally a physiotherapist. I've been a physio for about 8 years now. And I have trained in oncology physiotherapy, so helping people with cancer. And in that, I have also become a lymphedema therapist. So my business, the Positive Health Project, is located in Narellan and solely dedicated to helping people who have or have had cancer and lymphedema, and sometimes those two parts cross over as well. So I see a lot of women after breast cancer, so they've had surgery, whether it's a lumpectomy, a mastectomy, and whether they've had a breast reconstruction done as well. So scar management is something that I'm very passionate about, because a lot of women after these surgeries have scars, and if we can get them to heal as best we can, then that's really great for people's recovery. All right, so what we are going to do is we're going to talk about how to optimize healing through effective scar management, with managing swelling and the inflammation that comes with that process. So we want to understand the role of inflammation and how to effectively manage the inflammation and the swelling to enhance healthy scar formation. So we're going to look at the important role of inflammation when trauma occurs to the body and how it is actually helpful to not try and suppress this process. We're then going to have a bit of a look about the lymphatic system, the role it plays in healing and how to effectively manage swelling during the healing phase. And then we're going to look at the process of scar formation and how we can optimize scar formation. All right, so first of all, we're going to look at inflammation. Okay, so when there is an injury, we are going to have an inflammatory response. It is a natural defense mechanism that is triggered whenever the body's tissues are damaged in any way. Most of the body's defense elements are located in the blood, and inflammation is the means by which our body gets those defense cells and chemicals to leave the blood and enter the tissue around the injured or the infected site. So inflammation occurs in response to physical trauma, to intense heat and irritating chemicals, as well as infection by viruses and bacteria. The inflammatory response prevents the spread of damaging agents to nearby tissues, disposes of cell debris and pathogens, and sets the stage for the repair process. So there is 4 main signs of inflammation. So damaged cells release certain chemicals which signal the body that it needs help. And then this results in redness, heat, swelling, and pain. So the redness is due to an increased blood flow to the area due to our blood vessels dilating. The heat also comes with that, with the increased blood flow to the area. So a bit of warmth and redness will be felt. Swelling, which is the leakage of protein and nutrient-rich fluid into the area that is there to fight pathogens and get ready for healing. And then pain. Due to the damage in the area and the chemicals that are being produced, that causes a pain response, which is all about protection. It's all about protecting the area and preventing further damage. So if we take an injury that most of us have had at some point, like an ankle sprain, so a sprain usually results in tearing of ligament fibers in the ankle joint, leading to trauma in that area and the start of the inflammatory response. So most of us would know with a soft tissue injury, the acronym of RICE. It's in all of our first aid sort of stuff. And so that is our rest, ice, compression, and elevation. So now after everything I've said, we know that inflammation is actually a very important response. And RICE is actually all about trying to reduce that inflammation. So what we actually want to look at and do is peace and love. So we're going to look at that first part, which is peace. So we want to, yes, we want to protect the area, and we don't want to be moving it when it's really sore and got a lot going on in those first few days. So try to minimize bleeding and reduce any further injury to that area. We then want to elevate the limb or the area that's injured higher than the heart to try to promote fluid movement out of the tissue so we don't get excessive accumulation of tissues, fluid in the tissue. We want to avoid anti-inflammatory modalities. So it's really important that we have that inflammatory process happening because it helps get the body ready to repair those damaged soft tissues. So we really want to try to avoid those anti-inflammatory medications, your things like your Nurophens and your Advils, because we want that inflammatory process to actually go ahead. Ice can actually also potentially disrupt that inflammatory process and stop some of the important processes that actually get new blood vessels formed in that area and those white blood cells to the area, which can actually lead to impaired tissue repair and too much collagen synthesis in the area as well. So ice is really good for managing pain, but we don't want to be using ice too much if we can help it. We then want to use compression if we can. We can either do that via a brace, a bandaging, or taping to prevent excessive swelling in the area. So we know that swelling is important and has a process that it needs to undergo, but we don't want excessive swelling in the area or excessive bleeding as well. So compression still has an important part when trying to help with that initial inflammatory process. And then it's important that people like myself educate you on the importance of an active recovery. So as soon as that pain is under control and as soon as we can get going again, we really need to get moving so we can get the best recovery to those tissues as possible. So no more rice, we want to be doing peace and love. I haven't gone through the love part of this. I've got it on the next slide here. It's more about the rehabilitation and recovery side of things, not the inflammatory side of things. But if you want to know a little bit more about it, please comment and I can send you through a little bit more information. Okay, moving on to the swelling side of things and the lymphatic system. Okay, so everyone knows we have a circulatory system, but not everyone is aware of our lymphatic system. So it is a circulatory system as well, but it also is an immune system. And so it is a network of vessels, just like our blood vessels, throughout the entire body. And it has valves that get pulled open and it sucks fluid in from around our cells and protein and other bigger cells. And it helps to keep the fluid balance because we can't have too much fluid coming in and then no fluid going out because we'd all be round big fluid balloons. So some of that fluid, yes, does return into the circulatory system via our veins. However, there is things that our cells produce and other bits and pieces like proteins and fats, cellular debris and bacteria. All of these things are actually too big to get back into our veins. So we use the lymphatic system. And so this is what the lymphatic system in our body looks like. So we have lymph nodes, so high concentration of lymph nodes in certain areas throughout our body. And those lymph nodes are little toll gates and they help check the fluid as it comes in and then help process that along. So they actually contain special white blood cells called lymphocytes, and their job is to check all the bits and pieces that are coming in, and they help to either detect cancer cells or infection, and then that's when we get an immune response happening. So that's what happens when we get our inflamed lymph nodes in our neck when we're starting to fight a bit of a cold or a flu that might be coming on. So all of that fluid from all parts of our body travels through those vessels in those lymph nodes and comes up to a main duct, our thoracic duct, and it comes up through our diaphragm and gets dumped back into our circulatory system. So we have high concentration of lymph nodes in certain areas in our body, so under our arms, in our groin, behind our knees, around our neck and our face, and a ton around our abdomen. So if we are missing or damage any of these lymph nodes or these lymph vessels, then we can get a buildup of fluid in a certain area of the body. So when we get swelling in the body, it is called edema. Okay, and we've all probably had it at some point in our lives. So although at first edema might seem detrimental to the body, it actually isn't. The entry of protein-rich fluids into the tissue spaces due to inflammation helps to dilute harmful substances which might be present due to an opening in the skin, brings in large quantities of oxygen and nutrients necessary for the repair process. It allows the entry of clotting proteins, which form a gel-like fibrin mesh in the tissue space that effectively isolates the injured area and prevents the spread of bacteria and other harmful agents into the adjoining tissues. And it also starts to form a scaffolding for the permanent repair of the tissue in that area. So that's edema. Then if we look at lymphedema, that's actually a different process. So lymphedema is the accumulation of excessive amounts of protein-rich fluid resulting in swelling in one or more regions of the body. So it is due to a mechanical failure of the lymphatic system and occurs when the demand for lymphatic drainage exceeds the capacity of the lymphatic circulation. So lymphedema may arise because the lymphatic vessels or nodes have been damaged or removed, so damaged because of trauma or removed because of surgery, which can happen if we have cancer in the lymph nodes, or if these lymph nodes or vessels were not formed correctly or are absent. So our lymphatic system develops when we're in the womb as a baby, and sometimes congenital issues can happen and we are born without them. And so that is a primary lymphedema. So then if we look at swelling that is actually sticking around for longer than what it's meant to, so this is chronic swelling, so more than 3 months after an injury, this can be due to an impaired lymphatic system. So that might be, as I said, either the congenital reason or because of the damage to the lymphatic vessels during the surgery or the trauma. So usually if there's bleeding, that means there's been damage to the lymphatic system as well. So swelling is important initially, as we've said, but prolonged swelling can actually impair healing by preventing good blood supply, putting strain on the local tissues, and can lead to an increased risk of infection as well. So chronic swelling can really be hard to get rid of as well, the longer that the fluid is present for, because fat begins to infiltrate into the protein-rich fluid and start to cause fibrosis. So it's no longer that soft, squishy fluid, it becomes quite firm, blocking that reabsorption of the fluid. So we really want to be making sure that we're getting rid of that fluid once that initial inflammatory process has happened. So as I said, managing swelling is really important. It helps to enhance healing, reduce pain as well in the area, and minimize the risk of infection. So there's a few different ways we can do that. We can do that through movement. So muscles are the heart of the lymphatic system and promote lymphatic flow. We've also got elevation. So using gravity to assist with fluid removal from the area. And this can also provide pain relief as well. Stop that sort of throbbing pain that can happen after an injury. Compression, so we want to prevent, as I said, that excessive or prolonged swelling in the area. So we can use your medical grade compression, your braces and your bandaging. And then self-manual lymphatic drainage. So we're trying to clear engorged lymph nodes, stimulate lymphatic flow, and then provide an alternative drainage pathway if we've got damage in a certain area or a scar forming. The lymphatic fluid can't actually go through scar tissue, so we want to try to help find another way or go around that scar. So as I said, the muscles are the heart of the lymphatic system. So we've got our skeletal muscles, but then we also have our diaphragm that helps us breathe. So external pressure applied to vessels through muscle contractions and respiration and movement help push fluid from our limbs in the direction of the heart. So if we think we've got our skin and then our muscle, and then when our muscle contracts, it pushes up against the skin and the muscle sort of bulge together. So our lymphatics are in that space in between, and by contracting that muscle, we're helping to squash the lymphatic vessels and help move that fluid along. The changes in pressure, so when our diaphragm comes down and contracts, sucking oxygen into our lungs and stretching them out, we actually squash our abdomen and all the organs and lymphatic vessels in our abdomen. And so that change in pressure and pushing actually helps suck fluid from the tissue into the lymphatic vessels to really help promote lymphatic flow. So the breathing and the moving are really important to help stimulate lymphatic flow. Okay. So if we are looking at absorption and propulsion of fluids, as I said, we want to get the body moving and squashing those lymphatic vessels. So we've got a lot of lymph nodes actually in our joint spaces, because when we move, that actually helps clear them and propel the fluid forward. We have the muscles contracting, as we said, and then our breathing, but also our heart rate as well. So when our heart is pumping, it creates a bit of a beating and pressure against the lymphatic vessels, and that actually encourages absorption and propulsion of the fluid as well. So if we look at self-manual lymphatic drainage, we want to be, so this is when you're doing it yourself. So you also have the option of a trained lymphedema therapist such as myself doing a manual lymphatic drainage massage for you, which can be quite effective because we've got two hands. Sometimes you've only got one. So it can be quite helpful to get someone else to be doing it for you, and so you can learn the pressure yourself as well. So we have gentle upwards direction strokes. So we always want to be going towards the body and towards the heart. But what we want to do is to clear the lymph nodes first so that they're ready to receive the fluid. So we want to empty our buckets first before we then get them refilled. So we want to start close to the body and then move outwards. So we want a slow, firm pressure. And then, well, not too firm. Firmer if the swelling's been there for a while, sort of like you're patting an animal. So you sort of want to be stretching the skin, applying a bit of pressure, but we don't want to be pushing down and squashing too much because we're just going to squash the fluid out of the way. We want to be moving the fluid up in that direction. So the effects of this are temporary. So we still want to then try to maybe get some compression on to try to stop that fluid from refilling in that area. And the manual lymphatic drainage massage can actually be quite useful for areas that we can't actually get compression to as well. So certain areas of the body, it's just impossible to get compression, and that's where the massage can help get rid of that fluid as well. So when it comes to the lymphatic system, it actually has certain drainage patterns and pathways. So depending on where the fluid is in your body, depends on the direction you want to encourage it to come. So in the arms, we obviously want to go up towards the armpits. In our legs, we want to go up towards our groin. And so if we want to have a look at that illustration there, you can get an idea of where you might be wanting encouraging that fluid to go. But usually it's towards central areas where there's lots of lymph nodes. Okay, next is the fun bit, talking about the actual scar formation and management. Okay, so I've actually got a little bit of a video here. So let me bring that up for you so you can bring that up. Let me just see this one. All right, so going to share this video. Hopefully it works. All right.
The largest organ in your body isn't your liver or your brain, it's your skin. with a surface area of about 20 square feet in adults. Though different areas of the skin have different characteristics, much of this surface performs similar functions, such as sweating, feeling heat and cold, and growing hair. But after a deep cut or wound, the newly healed skin will look different from the surrounding area and may not fully regain all its abilities for a while, or at all. To understand why this happens, we need to look at the structure of the human skin. The top layer, called the epidermis, consists mostly of hardened cells, called keratinocytes, and provides protection. Since its outer layer is constantly being shed and renewed, it's pretty easy to repair. But sometimes a wound penetrates into the dermis, which contains blood vessels and the various glands and nerve endings that enable the skin's many functions. And when that happens, it triggers the 4 overlapping stages of the regenerative process. The first stage, hemostasis, is the skin's response to 2 immediate threats: that you're now losing blood and that the physical barrier of the epidermis has been compromised. As the blood vessels tighten to minimize the bleeding in a process known as vasoconstriction, both threats are averted by forming a blood clot. A special protein known as fibrin forms crosslinks on the top of the skin, preventing blood from flowing out and bacteria or pathogens from getting in. After about 3 hours of this, the skin begins to turn red, signaling the next stage, inflammation. With bleeding under control and the barrier secured, the body sends special cells to fight any pathogens that may have gotten through. Among the most important of these are white blood cells, known as macrophages, which devour bacteria and damaged tissue through a process known as phagocytosis, in addition to producing growth factors to spur healing. And because these tiny soldiers need to travel through the blood to get to the wound site, the previously constricted blood vessels now expand in a process called vasodilation. About 2 to 3 days after the wound, the proliferative stage occurs, when fibroblast cells begin to enter the wound. In the process of collagen deposition, they produce a fibrous protein called collagen in the wound site, forming connective skin tissue to replace the fibrin from before. As epidermal cells divide to reform the outer layer of skin, the dermis contracts to close the wound. Finally, in the 4th stage of remodeling, the wound matures as the newly deposited collagen is rearranged and converted into specific types. Through this process, which can take over a year, the tensile strength of the new skin is improved, and blood vessels and other connections are strengthened. With time, the new tissue can reach from 50 to 80% of some of its original healthy function, depending on the severity of the initial wound and on the function itself. But because the skin does not fully recover, scarring continues to be a major clinical issue for doctors around the world. And even though researchers have made significant strides in understanding the healing process, many fundamental mysteries remain unresolved. For instance, do fibroblast cells arrive from the blood vessels or from skin tissue adjacent to the wound? And why do some other mammals, such as deer, heal their wounds much more efficiently and completely than humans? By finding the answers to these questions and others, we may one day be able to heal ourselves so well that scars will be just a memory.
All right. Well, for now, scars are not just a memory. They are something that we all deal with. So let's come back to the presentation. All right, so as that video sort of outlines, we've got 4 main phases of healing. So we've got the hemostasis, which happens within the first few minutes to hours after the injury. So coagulation happens, forming a clot to prevent further blood loss and also seal the skin over so we're not at risk of any nasties getting in there. We then have the inflammatory phase, which happens sort of from day 1 to day 3. That's where we leak fluid to allow essential cells to the area, and it puts all the workers to the site. So it gets all the important things that we need to have for the next few phases to the site. Then we move to the proliferative phase, which starts around day 4, and that's where the scaffolding starts to be put up. So we grow new vessels and the scar formation actually starts. And it's normal for the scar to be red at that point because we're getting new blood vessels to the area so that we can really get as much healing and as many good things to the injury site as possible. We then finish off with the remodeling phase. So from about 21 days after the injury up to 1 to 2 years after, that's where we get the loss of those blood vessels because they're no longer needed. So that's when our scars can turn from that purpley red color to that nice white, hopefully hardly noticeable color that we like to see in scars. And the collagen matures and we get that nice, hopefully good, strong scar. But that's when the speed of the healing process starts to slow down. So we can actually get abnormal formation of scars. This can depend on different risk factors, which we're going to go through next. So we can get a hypertrophic scar, which is where there's excessive collagen deposits and the scar appears raised, but not to the degree that we get with keloid scars. So keloid scars actually grow outside of where the injury actually is, where the hypertrophic is just raised where the actual scar is. And so these keloid scars can be a bit rubbery or shiny and quite fibrous. And then we've got contracture scars, and these are characterized by extremely tight skin. And this can restrict certain areas to move. So all of these scars are abnormal, and there are certain risk factors that lead to these type of scars. So we can look at the severity of the original injury. And the size, the depth, and the location of the wound on the body. There's hereditary factors and ethnicity factors and color, skin color, that can impact how your scar actually forms and whether we're getting some of that abnormal scar formation happening. A person's overall state of health, fitness, and nutrition. So obviously the healthier and better our bodies are, then the better they're going to go through that process of healing. A person's age, obviously, yes, as we get older, the efficiency of that process starts to slow down. Diabetes and smoking, again, are shown because they impact blood supply, can really impact the healing process. And any complications that happen during healing, such as infection, prolonged inflammation, excessive bleeding, or delayed healing, all of these things can lead to suboptimal scar formation. Okay. Now, if we're looking at our optimal healing environment, our skin needs moisture. So to help it stay soft and to help it be flexible. So scabs and new skin need to be kept moist to prevent cracking and tightness in the area. Swelling can also stretch the skin and prevent nutrients from getting to the local skin around the wound, making it dry. And dry skin can crack and be a potential source of infection. And so this can lead to poor scar healing if we're infected and swollen in the area. So we really want to try to keep that skin nice and moisturized as much as possible. And I've heard fantastic things about mugu. A lot of my cancer patients who are having radiation or having dry skin issues really love the mugu. It's all natural and Australian made as well. I stock some of this in the clinic if you're interested in trying some. So it's a great natural moisturizer there. Okay, so how we can help treat scars and really get good scar formation. Okay, so low-level laser. I've got one of these beauties in the clinic and I love using it for as many patients as I can. It helps with the treatment of various conditions. So with healing of scars, with promoting lymphatic flow, for helping with pain. So the laser brings about a photochemical reaction at a cellular level. So the laser light penetrates into the tissue where it's absorbed by the cells and converted into energy that influences the course of the metabolic processes that are happening at a cellular level. So it really helps. Obviously if we can look at big picture of the scar of what we can see, but the low level laser really helps down at the cellular level. Then we also have negative pressure devices, which is like a very controlled form of suction. that helps to promote lymphatic flow. So it can help with lymphedema, pre and post-operative swelling and scarring, sort of fascial tightness and other pain issues, by helping lift the tissue and the skin and helping move everything around, and really help with making sure that the lymphatic flow can happen and that we are getting nice, soft, flexible tissue. Okay, scar massage, this is the good bits. This is what I love doing. There's so many benefits from scar massage, whether that's by someone else like myself or also yourself doing it if you have any scars. So scar massage can help reduce that feeling of tightness that can happen with scar formation. It also helps with the return of sensation. So if you've ever had surgery, you know that area around the incision can be numb, and depending on how big the surgery depends on how numb that area can be. So massage has actually been shown to help promote nerve regeneration and to get some sensation back to that area. It obviously helps to reduce the itchiness that can happen when we are healing. It helps keep new skin flexible. It helps to control and reduce unnecessary inflammatory signals. It helps reduce sensitivity. So new scars can be very sensitive and can be actually even painful. So we really want to be bringing down that sensitivity so that that area feels normal, isn't excessively sore or sensitive, so we can treat it as like it never happened. Scar massage can also help break down scar tissue that's deeper than the surface. So obviously scars, we can only see what's on top, but there's scar tissue deeper down, and depending on the surgery or the trauma, it can be quite deep. So it's helping to break up and get that scar tissue nice and flat and not sort of bumpy underneath the scar as well. It reduces adhesion to other structures. So when scars are forming, we can actually get that tissue sticking to other structures around it. So whether that can be organs or bones or other muscles or tissue in the area. And you can imagine if it sticks to something, then that scar isn't going to have very good mobility and can actually feel quite tight and quite painful. So we want to reduce the risk of that happening. Then obviously the massage can help soften and flatten scars out, especially if you get that puckering that can happen, especially with sutures, especially at the ends of scars, you can get them sort of sitting back up. So we want everything to sit nice and flat. This is really important, as well as all the physical ways that scar massage can help. It can help with the psychological side of things as well. It can help reduce those negative feelings towards a scar, whether that's from trauma or from surgery. It can be a not nice feeling to have a scar, and depending on where it is as well, it might be a bit visible, so we might not want to have anything to do with it and be a bit ashamed of where it is and be self-conscious of it. So by touching it, by feeling it, by getting used to it, by getting it looking good and feeling good, we can really reduce the negative feelings that we can have towards our scar. So with scar massage, we want to start gentle a few times a day once the scar is fully healed. So once that sort of remodeling phase happens, so sort of that 2 to 3 weeks after the initial injury happens. So we can start off with, like the pictures there, we can do a circular motion along the scar, depending how big it is. We can do 1 finger or 2, doing circular motion along that scar. We can then also do up and down. So we can either do just with 1 hand, or you can do 2 to do a bit of a zigzagging sort of pattern. We can do side to side, just going up and down the scar, or using 2 hands to be going either side of the scar and along the scar. And we can stop and focus on areas where we feel a little bit of extra tension or bumpiness underneath the scar. Sometimes it's good to have someone like myself do it for you for the first time or a few times, so you can get the feel of what it's meant to feel like. And sometimes it is easier for someone else to be doing the massage when it's a bit sensitive and a bit painful to start off with, because we don't like obviously inflicting pain on ourselves. So it's much easier to get someone else to do it for us. So I'm more than happy to help anyone who has a scar who doesn't really like touching it, because having someone else start off doing it can be a good way to get started. All right. Silicone. Silicone is very, very important with helping scars. All the research is about silicone. So there's different ways that we can use silicone to help with optimal scar formation. So we want to provide the optimal environment we can for scar healing. So we want to keep moisture in. We want to protect the fragile skin that is healing and getting better. We want to let oxygen in, and we want to prevent excessive collagen from being produced, which makes the scar sort of a bit raised. So we want to help keep that scar flat, which is what silicone tape and the silicone sheets can actually do. So this is silicone tape. This is some that I use at the clinic, which I absolutely love. I've got some on my arm here to sort of show you what it looks like on. Okay, it's sort of like a band-aid, but not, it sort of doesn't stick to your skin as much as band-aid. So as you can see, it sort of comes off a lot easier than what a band-aid does. So if you still have a little bit of scabbing there, it's not going to take the scab off with it. It's sort of waterproof in a way. It doesn't, you can wear it in the shower, you can wear it for a few days, even up to a week or so. It's really, really great stuff. I love it. And it can feel good to have that sort of protection, or if you're not quite used to looking at the scar yet, it's really good. So that's silicone tape. There's also silicone sheets, which is similar to the silicone tape, but it's actually just, it's reusable. So it's great for after surgery if you know you're going to be using the silicone for a while, or if you've got a larger scar as well. So you can just wash them with warm soapy water and reuse them. So the silicone sheets can be really quite good as well. So this is just a little bit of a graphic of showing how the silicone tape helps. As I said, we're just sort of trying to prevent that moisture loss. The silicone is semi-permeable, so it's breathable. So unlike when we get Band-Aids, they can sometimes not let the wound breathe. So it actually still lets oxygen in, keeps the moisture in, and sort of controls the collagen formation and helps keep the scars nice and flat. So we can also get silicone in other ways. So we can get sort of creams and gels that have silicone in them. So things like the ProSil and the Strataderm, what they do is they go on liquid, obviously, but then they dry and form a film over the scar. So it still ends up having the same sort of properties as the tape, but it's, excuse me, useful for areas that are a bit too small for the tape. Like in facial areas or areas that, you know, fingers and stuff where tape isn't really going to stay on too well. So the gel options are really quite good as well. So when to use silicone, as I said, we can use it once the wound is fully sort of sealed. As I said, it doesn't take scabs off with it, but usually around that 2 to 3 week mark after the injury or the surgery. As I said, it can be worn for 24 hours for a few days, but it's important to use it for quite a few weeks. We want to be using it for 8 to 12 weeks, or really for as long as needed. And the good thing is it can be used for both new and old scars. So even if you've got an old scar that's raised, it's definitely worth a try getting some silicone onto it to see if we can get it flattened. But also trying to use things like the laser can also help as well, and with massage. So trying to throw everything you can at old scars. The said scars can take a good 1 to 2 years to fully heal. So we can really still work on scars even if they're not fresh as well. All right, and then the last thing I wanted to talk to you about is scar oils. So I've worked with Catherine from Zanshin Natural Therapies to develop my own scar oil. So it's locally made and made only from organic and essential oils. And I love using this when I'm doing scar massage. They smell amazing as well, but they feel so good on the skin. So the scar oil has special selection of ingredients with vitamin E and other things in it to help moisturize the skin, to prevent that dehydration, keep the skin nice and soft. As research has shown that there's better healing in a more moist environment for those scars. We want to reduce unwanted inflammation. As we said, we don't want inflammation sticking around for longer than it needs to be. So we definitely, we've got some anti-inflammatory properties in the oil as well. And as I said, I love using it for when I'm doing scar massage. It just helps provide a little bit of lubrication to the scar so that we're not, you know, especially if it's sensitive, it can be nice to have that little bit of barrier and lubrication to the skin when we're starting to massage. So if anyone anyone's interested in knowing more about the scar oil, please let me know. I am selling it at the clinic. It's 30 mils, it lasts so long, it's really great, it smells amazing, it feels great on the skin, and I can send a list of the ingredients that are in it as well if you're wanting to know a little bit more about the oil. All right, so that's me done. I'm sorry if I've rushed. I tend to get a bit enthusiastic about things and get a little bit quick. So as I said, if you have any questions, please contact me in any way, either via Facebook or a comment. If you're interested in trialing the laser or purchasing any of the oil or trialing the tape, doing a massage or helping with fluid in any way, if you have any of those concerns, please let me know. We can book you in and get you sorted. I hope everyone's staying safe. I hope we're helping fill your weekend in lockdown. I hope you enjoy the rest of the talks, and I will see you on the other side. Thanks, guys. Bye.